I just want to raise a question. There was a reported and suspected death of a 17-year-old from the Shingrix vaccine. So I had a look at that sent to me. So I had a look at the product assessment report, and it said that there had actually been no safety and efficacy testing of Shingrix established in children and adolescents, and the indication was for people older than 50 years of age. Have you looked into why a doctor would give a child, a 17-year-old, that vaccine, given that that wasn't sort of what was recommended?
So, Senator, I'd have to take on notice whether we've had a notification in relation to that specific situation. And I should also note that it may be quite limited in what I can actually tell you, given the confidentiality and privacy protections within national law, but I'm happy to take on...
Okay, sure. So I'll ask a more general question. I guess, do you look at the TGA adverse event report to pick up things whereby, you know, vaccine injuries or what other drug injuries get reported, and then compare it to the actual product assessment report to make sure that doctors are prescribing drugs in accordance with what's on the actual indication from the TGA, the initial TGA recommendation?
So is your question whether we regularly review those data?
Yeah. Is there some sort of connection, you know, feedback loop between yourself and the TGA as to how doctors prescribe medicine, and if they're doing it correctly?
We have a close liaison with TGA, and we would expect that if they had a concern about an individual medical practitioner or any other registered health practitioner, that they would raise that concern with us, and then we would look at that as a notification through our normal processes.
Authorised G. Rennick, LNP Chermside.